Well, it's great to be here. Let me kick off. I haven't been here for, I think, over 20 years, so it's nice to be back. And it's nice to have this invitation to talk to you about a topic that I've done a lot of thinking about over the years, but certainly not yet have managed to change government perceptions, even if I have managed to change public perceptions. So I'm always hopeful that wherever country I go to, they may take up the challenge and forge ahead. And I suspect Norway is actually likely to be a bit more receptive to some of the messages than an old-fashioned country like Britain. So I started working for the UK government as a drugs advisor in about 1993, when we had the first concerns about MDMA, ecstasy deaths. And that was quite an eye-opening experience, because I realised there was absolutely no science behind anything the government was doing in relation to drugs. And I went away and I started to work from about 1997 on this report here, the Runciman report. And this was probably the best thing I've ever been part of. Ruth Runciman was a very senior figure in sort of British thinking life. She chaired this committee, which was set up by a charity to review the harms of drugs in relation to the law. And I was the doctor on that committee. And when I explained to this range of experts, from philosophers through to lawyers, journalists, how there was no systematic way of assessing the harms of drugs, they thought I was mad. How could that be? How could scientists not know how to assess the harms of drugs? So they told me to go away and get it sorted. So as part of that committee, if you read that report, you will see the beginnings of the scale of harm that I've worked on ever since. It took a long time. It's not an easy process to do, to get experts to agree. The committee didn't meet more than 4 times a year, so we had to do this as intermittently. But eventually we took all these drugs, including legal drugs such as alcohol and tobacco and cat and solvents, and we put those in because we thought it was important, first for the public to know that they're drugs, and second because they do provide some anchor points, because they're legal, we do have better data on them. Now, as part of that process, we did discover that there was some data. Not strong data, but potentially very important data. And one set of data are deaths. So these are the UK data on reports of deaths from drugs. And what we were able to do was look at the number of deaths and then make an estimate from either from police seizures or from questionnaire data on the number of users. And this concept of index of toxicity, deaths per million users, was developed by Les King, who was part of our group. And you can see that there is an enormous disparity between heroin and all other drugs. Jürgen admitted the usual intro that I get. He normally says that I'm the UK drugs advisor that was sacked by the government. And so I'm telling you that now in case some of you didn't know that. And I was sacked in 2009 for saying that, looking at this graph here, if you were the health minister, what would you want to change? Well, you know, it's obvious that you want to be doing something about tobacco and alcohol if you were serious about the harms of drugs. And what I was arguing that we had a peculiar focus on cannabis and ecstasy, which I thought was irrational, and in fact I thought was actually deceitful, because I knew it was happening because the government was hoping that they could ignore the deaths on the left by focusing public concern about the drugs on the right. And that was why I was sacked. And this was the first chart. This was the first chart of drug ranking. And you can see that alcohol was 5th, heroin was 1st, cocaine 2nd, barbiturates 3rd, street methadone 4th, alcohol, and then tobacco about 10th and cannabis about 13th. We were surprised at how high alcohol came, and actually the media were very, very surprised, because people had up to that point assumed that because alcohol was legal, it was probably less harmful than all these illegal drugs. The coloured drugs are the ones that are illegal. But there was criticism of the approach, which was, I think, quite fair. Essentially, each parameter was weighted equally. And that was because we had to start somewhere, and we didn't really know how to do it better. And there was also another question. We only took 9 harms. Are those the right harms? Well, obviously collapsing a lot of harms into a single harm. Social harm encompasses a number of different dimensions. And although most people were, and certainly most scientists were comfortable with the results, they seemed to make sense, it was still a subject of debate, and people were able to dismiss the conclusions on the grounds that we hadn't done it optimally. But soon after that report was published, I was contacted by a guy from the LSE called Larry Phillips, who said, I know a way of doing it a lot better. And he met with me and one of the other authors of that report, which is, I should have pointed out, that one of the authors of the report was the chair of the Medical Research Council in the UK at the time, Colin Blakemore. So it did have considerable support from the scientific establishment. And the first thing we did was organise a conference of experts to look at what harms of drugs we should consider. And we did this absolutely from the bottom up. And over the course of a day, we came up with every single harm any of us could think of that the drug could do. And then the next day, we collapse them into a series of separate parameters or criteria. And these are they. We think you can analyse the harms of all drugs according to these 16 criteria, 9 of which relate to the person using them, and 7 relate to society or other people. And they range from physical harms, such as whether the drug will kill you, like heroin does intravenously, whether the drug will cause damage as a result of using dirty needles, whether the drug can cause mortality from cirrhosis, etc. And then the psychological elements, the social elements to the individual, how you narrowing of people's social repertoire, etc. And then the social harms, crime, environmental damage, family adversity, international damage, economic cost, and community damage. So these we believe to be that's the full spectrum of harms that any drug can produce.